Hi, this is Rochelle Manigold, and this is my tech talk on state-of-the-art medical simulation facility. And for this tech talk, I'm going to be using the SimLearn National Simulation Center as my facility. And I really am privileged because the SimLearn National Simulation Center is located on the Orlando VA Medical Center campus. So they are literally right across the street from me. So how SimLearn came about was the title for SimLearn is the Veterans Health Administration National Simulation Center, SimLearn. So on July 17, 2009, the Acting Undersecretary for Health authorized the establishment of a National Simulation Training and Education Program for the Veterans Health Administration. So that is how SimLearn, the concept of SimLearn and the project came into being. So SimLearn is the National Simulation Center. It opened up the new facility in September of 2016 and is the overarching program within the simulation division for VHA. And it's a national program for advancing clinical simulation, training, education, and research across VHA. SimLearn started out with some pretty lofty objectives. So they had 7 of them, and the first one to establish a national simulation center focused on the use of technology that will enhance workforce training and outcomes of care. And they have established National Simulation Center, and they do work on workforce training. There has not been a lot of data collected to see how it is really affecting the outcomes of care. So establishing the Resuscitation Education Initiative, the READY program, as a national program for ensuring consistent high-quality BLS, ACLS, ATLS training across the VHA health system. What the READY program is aimed at doing is that you have to complete a portion of your skills for whatever certification you have every 3 months. And whether it be something didactic or if it actually is the hands-on skills on the mannequin. And what this has demonstrated and has proven is that people stay more current on their skills if they actually have to do them every 3 months instead of every 2 years when you take your BLS class and recertify. So the third one, develop and oversee a VHA strategic plan for simulation process modeling, training, education, and research. This is pretty much a work in progress. Even though SimLearn has been open for almost 3 years, they still are working on their research. So they do have some research leadership in place now. So that's looking up for them. The process modeling, training, and education, those they are accomplishing to the level that they are through the training programs that they offer. And their training programs are train the trainer programs. So you go there, you get the training, and then you take it back to your home facility and train your staff there. The fourth one is provide operational policies, procedures, standards, and guidelines on best practices for simulation activities. This objective they've been kind of, I guess you could say, lacking in. So really the SSIH, Society for Simulation in Healthcare, and ENAXL policies, procedures, standards, and guidelines on best practices for simulation activities are the ones that are being used. So the next one is collaborating with the Department of Defense, academic affiliates, and other non-VHA entities to advance mutual interest in simulation. I know that SimLearn has partnered with the Department of Defense on a few different things. They do have some academic affiliates in our area. UCF is one, the University of Central Florida, so they are literally in SimLearn's backyard, right across the street from SimLearn. And the other non-VHA entities, I'm not really sure on what other non-VHA entities they would have. that they're collaborating with. I know that when Dr. Haru Akuda was in leadership there was a lot of outreach and a lot of different kind of collaboration going on. So now he has taken a position outside of the VA, so I'm not quite sure where all of those collaborations are standing. The next one is to collaborate with VHA's Office of Health Information and VA's Office of Information and Technology to define the business requirements for an IT infrastructure to support the business needs of the simulation program. And at this point in time, the Orlando VA Medical Center's IT is the support for SimLearn. So they do have some work to do on this, so really quite a bit of work to do on it. And then the next one is assist in determining specifications and best value choices for simulation equipment and processes. SimLearn has equipment from multiple vendors, and the nice thing is that they really are a resource. So you can call them up and you can say, hey, I need this kind of simulator for this kind of training that we're going to be doing, and what have you guys seen that works great? What have you had struggled with, and what are pros and cons of different simulation equipment trainers? So they've really worked on that, and I hope that they are able to continue to provide that information. So the original reporting structure. So when SimLearn started out, retired Captain Harry Robinson was a SimLearn National Program Manager, and he took care of the business aspect of SimLearn. And he reported directly to the Veterans Health Administration Employee Education Service. Dr. Haru Okuda was a SimLearn National Medical Director, and he reported directly to Patient Care Services in VHA. And then Dr. Legia Arcaro, she's a SimLearn National Director for Nursing Programs. She reported to the Office of Nursing Services. So you can imagine a new facility with leaders, 3 different leaders in the key leadership positions, and each one of them reported to a different office in VHA. So you can just imagine how that really kind of created some problems. So I thought that area was taking care of that, and I thought that division was taking care of that and things. So there was a lot of things that weren't taken care of, but were assumed by everyone that someone else was taking care of them. So trainings offerings. So prior to September 2016 opening of the National Simulation Center, SimLearn was housed out of an old strip mall, and so they had some area in there. So they really did the best they could with the area and amount of space that they had. So they were able to offer the out of operating room airway management training, the Code Team Simulator instructor training, an introduction to clinical simulation, and the central venous catheter placement, and the PIC training, peripherally inserted central catheter. And then probably one of their highlighted or key courses, trainings that they offered was their simulation technology operations, maintenance, and practices, their STOMP training. So what that did was it actually, you would go and you would start with a mannequin and pretty much take it apart and put it back together and provide all of the maintenance that needed to be done on a yearly basis, and also learn some things to help with troubleshooting problems with the different equipment. So as of January 2018, they still offered the original trainings, and the ones that were added were the musculoskeletal clinician training and the musculoskeletal master educator training. They added a point of care ultrasound training, which they refer to as POCUS. They have a simulation for clinical excellence in nursing services, and what this is it's an orientation bundle, but it also can be broken up for different training needs. So things like if you needed to train like a clinical academy or follow-up training, post orientation, and things like that. And then there's the SimLearn faculty instructor course, which all of the faculty who teach at SimLearn need to complete. And also other faculty can come in and take this course, and it's a really great course because it really helps for people who have not ever facilitated simulation before. And then they offer the TNCC Trauma Nursing Core course and the Fundamentals for Critical Care Support training course. So those two are national courses, but you can take the training there at SimLearn to receive your certification in them. So the second quarter of the fiscal year of 2018, there was current leadership changes. So Harry Robinson had been detailed for quite a while to an area, and Dr. Haru Akuda had been detailed to the patient care services area, central office, to help with some things. And what really happened is that SimLearn it was just really struggling. So current leadership wasn't in place, they were off being detailed, and a lot of other things were happening too. So in the second quarter of the fiscal year of 2018, EES steps in, so the Employee Education System steps in to oversee SimLearn. Complete inventory was done. They found that there was great areas for improvement there. What had happened was, because they were in that small strip mall area, they didn't have storage area. So they had to contract and rent storage area from multiple facilities. And unfortunately, some of them were not climate controlled, and simulation equipment doesn't do well in those areas. And then also it came up, there was quite a bit of inventory that was not able to be accounted for. So they had to take a complete look at that and re-inventory everything and just kind of start over. So there were 7 training topics that were being offered. Total of 17 training sessions were offered, and then the decision was made to suspend training from January 2018 to June 2018. And what this was for was because of all of the kind of just implosion and upheaval of leadership and some multiple other factors. And one of those factors was staffing issues. They had over 26 open positions. They didn't have enough staff to teach, to travel for the activations, simulations that they assisted with to assist with the rollout of new programs VHA wide. So they needed to really take that time out, and let's just do a timeout, a pause, and get some people hired and trained. So the first quarter of the fiscal year of 2019, they had 14 open positions were filled of the 26. So things were really looking up. The only problem with that was 9 of those were internal promotions. So it was required filling the positions that the people who internally promoted had previously occupied. So really, they had only filled 5 of the 26 positions. So they continued to work on recruitment, and they were working on increasing the number of trainings that they were able to offer. So with getting some of those people in and getting some of the new people in, getting them trained, and then also getting leadership back into place and being where they needed to be, they were able to start increasing the numbers of trainings that they were able to offer and staff. So the current status is there's new leadership established. So Eric Bruns is the new director. Scott Wiltz is the associate director for the medical aspect of it. And I believe Lisa Baker is the one who works closely and pretty much parallel with Dr. Scott Wiltz. And there is no one as the nursing director, the national nursing director position at SimLearn. Lygia Caro still holds that position, but she is not part of the SimLearn leadership. So, as with every service, every facility, there's some things that we can get really, really right, and there's some other areas that need a little bit of help in. So some of the things that SimLearn gets right is they have a beautiful state-of-the-art simulation center. So it is laid out so they have a car, they have an ambulance, they have multiple simulation areas, ICU rooms, med-surg rooms, office clinical area rooms. They have a control room that's spectacular. They have an OR surgery suite area. They have an eye area. They have all different kinds of things. And plus they also did it right by providing enough conference space and rooms so that people can not only do the simulation part, but they can also do the didactic part. So another thing that I feel that they really get right is that they provide you with the necessary equipment and supplies to do the trainings offered. So when you're there receiving training, you get all of the things that you're going to need to successfully perform the training or carry out the training. And this is really great because you can actually take packages back. You can take, serial numbers, whatever you need to, back to your facility so that you can get the same equipment for your trainings. Replicable training for Train the Trainer. So their courses are Train the Trainer, and some of them are certification courses, like I said, but the training, you can take it back to your facility and you can implement it without reinventing the whole wheel. So I think one of their biggest wins and thing that they get the most right is their simulation techs. They are available for questions and troubleshooting. And I'm very spoiled because they are right across the street, so they can even come and, on site help me out with some things if I'm having trouble in the sim lab at the Orlando VA Medical Center. But also you can call them, you can email them. They'll FaceTime with you. They'll do whatever they need to do to help you out. So that's a huge benefit, as most of the VHA simulation labs consist of a simulation lab coordinator, and that's pretty much the staff. So they have some really solid trainings being offered. I'd mentioned them on the slide earlier. Their STOMP training and their POCUS and MSK training have long waiting lists to get into them. So that's a good thing. And they do activation simulations. So what that is if you are creating a new department, a new service line, or even like we did, a whole new facility, they'll come on site and they'll run activation simulations. So an example I can use is we did one for a patient being admitted from the emergency room up to an ICU room and then being treated in the ICU room. And going through the simulations, what we found out was when the ICU provider ordered a potassium IV supplement, none of the pharmacists in the pharmacy had mixed up potassium IV supplements before because they had all worked in an outpatient setting. So what the activation simulations help with is not only processes and policies, but also identifying those areas where we could then, in like the example I provided, go out and you can, when you're hiring pharmacists, you can look for and hire pharmacists who have the acute care inpatient experience. So they really help with setting up staff training, but it's also for staff and patient safety and just to provide the working environment and the care environment that the veterans need and that they can expect to be cared for at a high level and safely. So, and then the knowledgeable trainers. SimLearn has some really knowledgeable trainers. They have varied backgrounds, and there's quite a few of them that teach in the field besides SimLearn as like another job or work as EMT, paramedics, things like that. So, and there's a few of them that are going back to school to advance their degrees also. So they really have some knowledgeable trainers. Some things that SimLearn needs to work on. So fiscal management is a huge thing they need to work on. I think with EES's oversight, I think that that will come right along and everything, and I think that they'll really get that straightened out in little to no time. So their retention and recruitment, they really need to work on. They've had a tremendous amount of turnover, and that's really costly, number one, but also really impedes on them being able to offer training. So recruitment, they need to really look at what they need. They need to take and do a real deep dive needs assessment of the kind of or level of staff that they need in the areas. So when they do their recruiting, they can really get the people in there trained and working that are going to help benefit the whole training mission and just SimLearn as an entity. So another one is defining the mission and vision. I know that this is being worked on, and I think personally myself that this is one of the first things they need to work on, because if you don't know what your mission and vision are, then it's really hard to work towards anything. Faculty development also is an area where they can do a lot of improvement. So there's some nurses that have been there for 4 years or more, and there's been really no faculty development offered for them. So, and also I think faculty development as a facility whole would be a great thing for them also. So do some of that team building and team training. Evaluations post-training. So SimLearn's really great at doing like level 1, level 2 evaluations, but they really need to look at getting those level 3 and level 4 and seeing what a more long-term impact of the training that they provide is on the VHA facilities, patient outcomes, those kind of things. So they do have some research people in place now, so hopefully they can start collecting some data, and with their curriculum developers, they can work on some evaluations. And the needs assessment, like I said, is just really finding out what is needed in the actual facilities for training. So unfortunately, time and money have been spent on developing training, and then come to find out that there already is evidence-based training or evidence-based resources available for the areas that they had created it also. So it's not really cost beneficial to recreate training that's already out there and has been proven to be effective and is backed by evidence-based methods. So, and then identify who makes what decisions. So is SimLearn making the decisions, the SimLearn leadership, what decisions can they make? And then what decisions is EES required to be involved in? And I think once that's decided, that will help them to kind of reestablish or establish the new leadership at SimLearn. And then also, I think that EES can kind of have maybe a more hands-off approach to working with SimLearn. So it's kind of interesting also. So I was at a meeting today, and the simulation fellowships were being talked about, and the interprofessional simulation fellowship. SimLearn is the hub for that, and there was some Office of Academic Affiliations people on site and everything, and they just really have identified that they need to pretty much rework that whole fellowship. So they need to be more involved as the coordinating center, and they need to really really just put some more depth and breadth to the fellowships, and have more defined or better defined expectations and requirements of the fellows themselves. So as every facility does things right, areas where we can improve, and SimLearn is no different, but I really think that that the ship was sunk at the bottom of the ocean, and I think it's been pulled up, and the water's been taken out, and they're really working on getting the ship in the right position and on the right path. So, and that ends my tech talk on simulation facilities, state-of-the-art simulation facilities, and SimLearn in general. Thank you.